Nurse.org and Major League Sports teams are honoring nurses with discounted game tickets and once-in-a-lifetime experiences. From throwing the first pitch to riding the Zamboni to on-court recognition, join the fun. Visit nurse.org/nurse night to find a nurse appreciation event near you and grab your discounted tickets today. You're listening to Nurse Converse, presented by Nurse.org, a collaborative podcast amplifying diverse nurse voices. Get ready for a dose of inspiration, a sprinkle of education, and a whole lot of community.
Hello, welcome to the Nurse Converse podcast with Nurse.org. My name is Rebeca Leon. I am also known as Nurse Reb at Enfermera Mami. And today we have a really special episode for you because it is a partnership with Vot-ER talking about civic health awareness. I have two special guests who I'm so excited to talk to and work with even more. But a little bit of background is that Vot-ER is a nonpartisan organization that was founded to find the best way to holistically help patients improve their overall health and looking outside of the clinic walls and how this impacts patient surroundings. So the two special guests that I have with me are Marcos Damien Noyola, who is the Deputy Director of Partnership, and I have Gilanie de Castro, who's a former fellow from last year and a nurse leader and advocate. And then the reason why this is so special to me is because I am one of the Civic Health Fellows for this year, and this is my campaign. So I am really happy to be able to share the stage with these wonderful people who really just bring so much knowledge. And I hope you'll learn a little bit something about how civic health impacts us every single day, why nurses should get involved and engaged, and why it's a little bit of public health. So we're going to start by allowing our special guests to introduce themselves. Marcos, can you tell us a little bit about the work that you do?
Yeah, thanks so much for inviting me. I'm really excited to share more about Vot-ER. So I've been with Vot-ER for about 4.5 years. And over these last few years, we've been able to grow essentially this movement of healthcare professionals across the country, thinking about folks that are physicians, social workers, nurses. We've started to expand our work with community health workers. But really, what we're trying to do is work with these health professionals and the institutions that they're a part of to turn out their communities to vote. But again, really excited to be here. And I come from a public health background myself, so just really passionate about community-based solutions. And that's a little bit of what we do here at Vot-ER.
Gilanie, what about you?
Sure. Well, currently I'm a nursing leader at a national cancer hospital. I've been in a leadership role for about 6 or 7 years now. Prior to that, I worked almost every role at the bedside within oncology and was not really into politics or did not even know what civic engagement was until 2020. And if you remember, that's when the pandemic really hit us hard and was starting in this country. And I really started seeing the important relationship between nursing and national policies and politics and government, and how we as nurses need to take a more active role in advocating for our patients beyond the bedside. And in that journey, I kept looking for tools so that I can learn more about how to engage in policies. And a good friend of mine told me about Vot-ER. And we joined the fellowship together. I met a lot of passionate healthcare professionals from all over the country who really know the importance of civic engagement and why we need to engage our patients in voting. So it was a wonderful fellowship, and I'd love to engage with Vot-ER as often and in any way I can. So thank you so much for asking me to be on tonight.
And I love to hear that because we all come from such diverse backgrounds, but ultimately what is bringing us together is this wonderful organization and the mission of making a healthier democracy, right? And making it easier to access all of these different tools and knowledge, because ultimately knowledge is power. And that is so, so important. So I appreciate y'all for, again, being here and playing with me this evening while we go through this podcast episode and telling a little bit about your stories, because that is in part what makes us as healthcare workers or people that work with patients so powerful in part in our democracy, right? Is sharing our stories. And everybody has a little bit of a different way that they get to this type of help. So I know for me, I also work in oncology, so we love to see our oncology nurses out here. I do nursing professional development, so I do education. I don't necessarily work at the bedside. So a lot of the work that I do in my day job doesn't necessarily directly involve with patient outcomes. So that's why for me, in part, it's so important to be able to give back to the community and create a more direct impact through something like this. And for me, the way that I found Vot-ER is because I am part of the National Association of Hispanic Nurses, and they sent out a little email saying, hey, you should be a part of this. This is an opportunity that's out here. And I said, well, why not? let me apply and see what happens. And thankfully, I was able to be accepted into the fellowship and get a scholarship. So shout out to Vot-ER because you're making it accessible for us to be able to access these resources and learn from such incredible people, right? But I will say, for me, as an immigrant, especially, I am a citizen of the United States. So thankfully, I do have the privilege to be able to vote. But civic health for me started when I was a little girl in Venezuela, because voting is so important in Venezuela. I don't know if y'all know about this. A lot of people don't. But in Venezuela, when you go to vote, you actually, instead of getting a little voting sticker like you do here in the United States, you get your little pinky dyed purple just to make sure that, like, if you have voted, you can't vote again. And that's how they do voter verification. And that's something that I grew up with and always stuck with me. Now, I was never at the age where I could vote in Venezuela, so unfortunately, I haven't had my little pinky dyed purple, which is such an awful thing because I would love for that experience. But I get to exercise my rights here in the United States, which I think is so important, especially in this time where health is so connected to policy. And everything that we do is so connected to the outcomes, right? So I just absolutely love that. And I appreciate Vot-ER's mission of not just connecting healthcare workers, but also connecting our patients to that in a nonpartisan way, which is huge. So with that, for y'all as individuals, why do you feel like civic health is public health? Like what does that statement mean to you?
I can share a little bit about my perspective and a little bit of my narrative and story and how I ended up here at Vot-ER. So when I think about civic health, I think primarily of this tight-knit connection between these political determinants of health, like policy that's being made, voting, that are ultimately impacting the health outcomes of communities, right? So essentially what we see in the research at both national, state, and city level is that states that have more voting access typically have better community health outcomes, and the opposite is true as well. So this research was done by Healthy Democracy, Healthy People. And if you want to go look for it yourself, you can do so by looking for the Healthy Democracy Index, I believe. I will have to verify that after. But it's a great resource to really look at that relationship. How does that connect to me? Well, growing up, I would say I experienced, right, a lot of these, limited access to healthcare growing up. My parents were both immigrants. We were a low income family. So accessing healthcare was at sometimes difficult. And the example I can share with you all is growing up in middle school, I was destined to get braces, and that meant going 2 hours east from where I was living at that moment to get my braces. It was the only place that was accepting Medicaid to do this orthodontics work. So that was my life for 2 years, going 2 hours, 4 hours round trip to Miami to just get my braces tightened, checked, and so forth. So my mom, had to take time out of her work to go do that. We actually carpooled with a friend of hers who also had a son that also needed braces. But so by just the luck of the universe, we had this essentially little group of us that would go every single month. But all of that to say is policy, voting ultimately have such a critical impact on the health of communities. In my case, growing up, it was access to dental services. And for others, it's a whole wide range of other different healthcare services that they need, right? So it's really important that we uplift this relationship and also these stories of people that have essentially experienced policy that has negatively impacted them. But would be curious to know, Gilanie, what you're thinking as well.
Yes, and actually, I'm just smiling right now because I think we're all over the country, but we have a common bond. I myself am an immigrant, my parents, and I came here in the early '80s, and eventually became citizens. But again, we were low income, even though my parents were professionals in their country. Basically, they were starting over from scratch here, and had to navigate so many systems, including the health system and the health care that I received growing up. Looking back, wasn't consistent, but also knew that my parents were trying the best they could to navigate the system they were unfamiliar with. They spoke English, so that was one barrier out of the way, but still, if you're coming from a different country, knowing that the system's not the same is difficult, and you want to take care of your family and your kids. And I remember the times going to the county hospital here and being escorted by my mom or nurses from one place to another, not knowing what was happening. But again, it was wonderful services that they had. And looking back, I can't say that I wasn't well taken care of. I mean, I think, like there were really great public health programs in our county that existed at the time. And now being on this side where I'm a nursing administrator, a nursing leader, seeing what's out there, I really appreciate that we have these programs for our underserved communities. And, I have a lot to thank these policies that were in place for that. And so, in a way, why I'm involved in civic health and getting more nurses civically engaged is a way for me to give back to the community and give back to these institutions that took care of me and my family as I was growing up. Also, I realized, and pre 2020, I was definitely one of those nurses that didn't even know, like I said, what civic engagement was. But when I learned about it, I realized that most nurses don't know that there is a connection between the bedside and politics or the government. And again, this is nonpartisan, but if you think about where laws and policies are made, right? If it's in Washington, D.C. or at your state capitol, it starts from somewhere. And there is a direct connection from what happens there to how we take care of our patients at the bedside and the laws and regulations we have to follow. So that's just a little bit of my background and why I'm so passionate about making sure that nurses know what civic engagement is and doing what they can or giving them tools so that they can do what they can to build better communities around them.
Stories are so powerful, and I appreciate y'all for just sharing that with us because I think y'all gave some really concrete examples of the things that you've experienced that I'm sure many of us have experienced, especially those that are listening. But I want to break it down a little bit even further into more simpler terms, right? Some of the things that y'all highlighted was access, right? Having to drive 2 hours to try and get dental treatments, which is wild. And I say that because my mommy's a dentist in Venezuela. So I grew up with like having that access and I'm so grateful for it. But you had to travel 2 hours to access something that should be so simple and so easy to get because it, especially growing up, right? Braces. That is such a canon event for being a child and for being a teenager, right? But the fact that it took that much effort to do, but the fact that you all were also willing and able to do that, I think is speaks to your character and like the need and want to get the care. But it shouldn't take our patients and our folks to drive 2 hours to get the care that they need. And we also talked about affordability, right? Through Medicare and Medicaid programs that, again, make it accessible for our patients and for ourselves to get the services. And I don't think people realize just how impactful all of these things are, especially in a time like this, right? And you mentioned COVID, Jelani. And I know for me, I was a baby nurse in COVID. I had just hit my 1 year as a nurse. I have always had an eye for just policy and advocacy and things like that. But I don't think I realized just how much it impacted us at the bedside until COVID, because that's really when you saw, oh, there's no medical supplies. Oh, these patients are coming in sick. And especially when you don't know what's happening, and now you have social distancing policies, now everything is shut down. Now you have, your entire world has been flipped upside down, and you don't know what's about to happen next because people lost their jobs, they were furloughed, things, like I said, were closed. And then here we are at the bedside, just trying to make it happen. As a new grad, I don't think I realized just how impactful it was until COVID.
Hey nurses, looking for exclusive discounts? Nurse.org has you covered with deals on everything. Save big on the essentials you need to excel in your career. Don't miss out. Visit nurse.org/discounts for the latest discounts made just for you.
And at the time, I was a new nursing supervisor, so it was even, we were scared about how we were going to take care of our families at home. But then another layer was, how do we take care of these patients without gloves and masks? How do I take care of my staff? I don't want them to get sick. So, and I always thought, somebody has our back, whether it's a CNO or CEO or somebody had our back as nurses, because our work at the bedside is so important. But then I realized, nope, nobody has our back, and we have to take care of ourselves. And that's when I started to get more engaged in seeing, what we as nurses can do so that, if unfortunately there's another catastrophic event like this, no nurse is going to be in that same position. And much respect to you as a new grad. I mean, coming out of nursing school at that time and going into that kind of world where experienced nurses were also at a loss, right? I respect the new grads that came out at that time, because it was not anything that I don't think any nursing school could prepare you for. So much kudos to you for doing that and sticking it out.
Listen, and being a new nurse leader, that's tough. So you did that. I just think it's so fascinating, especially because taking it back to nursing school, right? We learn about social determinants of health, but do we really take the time to realize that there are policies that are actively either making them better or making them worse? I don't know. For me, the answer is no. I don't know that I realized just how impactful it was. And we talk to these things about patients, right? Like, what are some of the ways in your experience, either one of you, that like housing, air quality, reproductive health, all of these like things really impact our patients? And how have you seen policies impact that?
Well, I can take it from there. And again, my background is oncology, and you're an oncology nurse as well. So you know how important it is for people on chemotherapy to continue with their treatment. They can't have any gaps or anything at all, if it can be helped, because otherwise we don't want to give the cancer an advantage, right? They have to stay on top of treatment. So during COVID and through this year, there is something called telehealth or telemedicine. I know that I've used it myself to see my doctor, but prior to 2020, I'd never had heard of it. But it was, a bill passed by Congress so that patients could maintain access to their healthcare providers without leaving their home. And so I think a lot of nurses didn't realize that that was something that came from the government. There were policies written, there were laws, and people voted on things in order to get telehealth passed. And it's not guaranteed, right? Depending on what happens with our current administration right now, we may or may not have it for the future. And that's definitely going to impact access. So something that you think is given or is guaranteed, if you dig deep enough, it probably is because of a bill or something that passed in the government, and that's not necessarily guaranteed. Bringing it to the local level, I'm in California. I always thought that nurse to patient ratios were something all over the country. Then when I started meeting nurses from other states, I was like, oh my gosh, you have how many patients? And I always thought, no, 6, 7 patients. That's what all the nurses have to practice safely. But again, nurse to patient staffing ratios in California is because of legislation that was passed. So again, voting, getting involved in policies is so important, because it is a way for us to also raise our voice with our profession and how our profession is run.
We feel the impacts of staffing ratios every single day, no matter where you are. And telehealth, that's a good one because people didn't realize the power of connectability in that way and being able to care for those patients in rural areas and allow them to have the same access to that high quality care that we need to provide them. And that's not just for, providers, MDs, nurse practitioners. That's also for us because there are nurses that do telehealth visits too.
Yeah, something else that's coming to mind for me is so another really big audience or part of the healthcare community that we work closely with are community health centers or federally qualified health centers. So these health centers are serving some of the most disinvested communities across the nation. So thinking about folks that are in like rural communities, for instance, these health centers play a critical role in letting them access care. So one of the policy action alerts that Vot-ER was working on this past summer was defending Medicaid, as there was a bill that was threatening funding to a lot of underserved communities. And so I think that is just another example of this relationship between voting and health that we're seeing, and all that's playing out in real time, right? As we're all seeing on the news. So thinking about funding for access to care is another way that voting and policy play a really big role in community health.
Ultimately, voting attracts and gains people's attention, especially in the political realm, right? We put these people there and they're supposed to represent our interests. They're supposed to support the work that we're doing. They're supposed to help our environment. And we're not telling nobody how to vote or which way they should, right? That is up to you to find out what all of this means for you and your personal impact. But what we are saying is you have to use your voice because ultimately using our voice in that way is going to help translate and improve community investment. Because if we're not saying, hey, come and support this community or this is something that matters to us here, then the powers that be aren't going to know that that's happening, right? So nurses are always the toughest patients, right? But we're also voting at lower rates. So why do we think that nurses are voting at lower rates in comparison to not just healthcare partners, but like other professions?
Yeah, it's interesting when I heard that statistic that nurses vote at lower rates compared to other professions. It really stunned me. Coming here as an immigrant and then becoming a citizen, it really made me understand the privilege and the value of voting. So that's something ever since I could vote, I've been voting in almost every election I could, either in person or, I can mail in my ballot. And I always thought it ironic because as a nurse, how many times have you said or even heard, hey, nobody ever asked us, right? Something changes in the station, they move something, or they built some new construction for something. And they're like, hey, how come they didn't ask the nurses? We have to work here. But when it comes to voting, that's what it is. It's your opportunity to raise your voice. You have the knowledge. You are there with the patients. You hear their stories. You know what's happening in the communities. And I think we have an obligation, especially with our code of ethics, to raise these concerns with our lawmakers, just like in the hospital, right? Like we advocate for our patients, whatever concerns they have, whatever issues they have. We escalate them to the doctor, the social worker, whoever we need to talk to. Same thing beyond the bedside, outside of the hospital. We need to talk to our lawmakers and say, hey, this is a real issue in our community. This is an issue with our patients. And if you can't have that conversation with your lawmaker, then you exercise your right to vote and you vote on issues that are going to make a difference, a positive difference in your communities. So that's something I like to share with nurses is that we need to be part of all these conversations and we need to be making our voice heard at tables where these important decisions are being made. One of the most important ways to let our voice be heard is through voting. And so I wish I could give you a reason why. Maybe it's the 12-hour back-to-back shifts and they just don't make it out to the polls. Could be that. But if you have the ability to mail in your votes, or there are institutions out there where they let you take time off to vote, basically exercise that right to do that so you can go out and vote. But also, I think with nurses, we don't believe that politics is our lane, but voting is not politics. Voting is a way that you let your lawmakers know what's important to you and your community or your patients. So just some theories I have, but part of my mission is to make nurses aware that, especially with almost 5.5 million of us all over the country, we have the collective strength to create better communities and healthcare systems with our vote.
And now, Marcos, you work with a lot of different types of healthcare workers through Vot-ER, and you see it, and I'm sure you hear it. What are some of those barriers that healthcare workers in general are facing or that you've seen? And how can we break those down a little bit?
Yeah. So one huge barrier, I think, for all of us is time or finding ways to make that time, right? Or effort. So I think another really great part about what we do here at Vot-ER is we're not just interested in getting people, eligible voters, registered to vote. We're also wanting to make sure that they get to their polling location, right? So we're taking them on this journey to election day, essentially, all the way to when they submit their ballot. So essentially, the kind of information that folks get are a lot of nudges, right? So a lot of reminders, whether it's text or emails. These have been really critical to making sure people turn out. It's just a very simple but effective way to make sure that they have all the right information at the right time, right? So thinking about those really important deadlines that come up all the way through election day, like voter registration deadlines. Perhaps you live in a state where you need to turn in your mail-in ballot by a certain time. So all of that information is included through the tools that we provide. Our partner TurboVote helps make sure that we're able to send this time sensitive and relevant information when they most need it. And one more thing that I'll add related to our healthcare professionals, particularly some health professional students. At the University of Cincinnati, we actually had a team of students institute a time off to vote policy. So this gave folks reserved time each year to exercise their right to vote. So that's a really, I guess, unique solution that these health professional students had instituted across their medical school. And it's actually a resource kit on our website. So if you're interested in doing that, that's something that we have tools and instructions essentially on how to do it.
That is really awesome to hear. And I love how accessible these resources make it for us as individuals and for our healthcare institutions to make a difference. Now, I do have to clarify for the audience these resources are free, yes?
Correct. They are free. But of course, we welcome any donations. So these resources really are meant to support communities across the board, right? So we understand that folks that we're working with, I'm thinking specifically about, our community health centers might have, finances be a blocker in being able to do this work, right? So that's why we always want to make sure that our resources are free. And I'll even add that if you're a community health center or federally qualified health center, you are eligible to receive a small amount of grant funding to do this work. So another creative way that we've started to do this work is through nonpartisan text messaging. So this kind of serves as a way for the health institution or community health center in this case to play as a role as that trusted messenger, that trusted voice to share this information with their patients. So up until election day, they'll receive these customized text messages from their healthcare providers, folks that they trust and are seeing often. And that's a really central part to our model and how we do our work here at Vot-ER is really elevating the trusted voices and messengers throughout the country. And that's going to look very different across communities. And we absolutely, encourage healthcare professionals to find the right people, right, and to support their overall organizing efforts, because it truly takes a team to do this work. And so I don't encourage you to do this alone. We call those people lone wolves. So we want to make sure that you're not a lone wolf and that we get you with other lone wolves to have this really wonderful group that's organizing and building impact and moving voters and communities to action.
Again, I want to direct our listeners to Vot-ER's resources. You can go to vot-er.org/join to order free badges, get some additional training, or just learn about this wonderful fellowship that we are a part of, because honestly, this has been such an impactful part of my year. And I am so grateful to be in this fellowship, but also be able to bring my other passion, which is working with Nurse.org, to make sure that this gets out there so that way all of you also have the tools that you need to be able to support your communities, because ultimately at the end of the day, that is what matters. And remember, nursing is inherently advocacy. So we have to be able to, again, use our voice and tell our stories about how policies have impacted the work that we do and impact the patients that we serve. But I want to thank you all so much again for joining, and thank my special guest, because this has been such an incredible conversation. I am so grateful to be surrounded by these amazing people. And this is just a little taste of what the fellowship has to offer, because we have these conversations basically every other week, and we get to hear from healthcare professionals across the nation. And it has been just such an empowering experience to be able to be in their presence and see the amazing work that they're doing. So please go check them out and follow them for more information and to even access the resources. Be sure to listen to this whole podcast all the way through. Rate it and like it if you enjoyed it. Shared it with a friend or a coworker who might benefit from some of this information. And of course, not just follow Vot-ER, but follow me, Enfermera Mami, at .rn. And of course, my friend Gilanie. And go ahead and shout out your socials so they can find you too, so they can see all of the amazing work that you're doing.
Yeah, please follow my platform, Citizen Nurse, all one word, and I'm on TikTok, Instagram, and YouTube. And I love to talk about how nurses can be more civically engaged. So please check me out.
And of course, be sure to follow Nurse.org for all of the wonderful resources and things that we have coming out, not just with the Nurse Converse podcast, but also with social media and other engagement and different campaigns that are happening. So thank you all so much for listening. We really do appreciate it.
Thanks for joining Nurse Converse, brought to you by Nurse.org. Help us grow by leaving a 5-star rating and review on your favorite podcast platform. Nurse.org supports nurses with career and education tips, life advice, and breaking news. Thank you for all you do and for being you.